feels a real honour to be asked along here today to share my experiences, learnings, observations of practice, and more recently jumping into education. I think the presentation is going to cover the same, but it'll just be slightly different. I'm not too sure what's going to come up next. Yeah, so we're looking at person-centred technology, but it's the same issues that we're going to cover today. And I guess the reason I wanted to focus on person-centred technology is because a lot of the discussions we tend to have around technology is about the devices, the positive outcomes that it can provide, and the differences they make to people's lives, which is really, really important. But underneath all that, there's a really difficult process that goes on to enable that to happen and ensure that we can deliver person-centred technologies. Sometimes we achieve it, sometimes we don't. And I just really wanted to kind of discuss some of those reflections with you, because I'm not an expert by any manner of means, but I thought there's probably more experts in the room, but hopefully it might give you some kind of thoughts or ideas, or potentially you might have other thoughts on the whole idea and how to deliver. Just a tiny little bit about me. So I'm an occupational therapist by trade. I was in clinical practice for just over 12 years. About 10 years ago, I had the opportunity to work with a very small team of a senior occupational therapist and support workers looking at how technology could be used in an occupational therapy context to enable participation. And particularly with people living with brain injury and neurological conditions. More recently, I've jumped ship to teach for a little while, so I'm a lecturer and practice educator tutor at Queen Margaret Uni. And technology is a big part of my work there as well, I should add. So, as you can see. Yeah, sure, sorry. Is that better? Okay, thank you for letting me know. Sorry about that. Okay, so based on reflections and observations and working with individuals with brain injury, I mean, I'm not going to hear and profess what it's like to live with a brain injury. I don't know. But what I think I'm about to say relates to people living with brain injury, but also a lot of other conditions across the spectrum. And people who have had big life-changing effect tend to not experience disability or only experience disability when they're unable to participate in the essential and valued occupations that they want and must be able to do. So really just talking about the importance of the activities that they want to engage in daily life. And this can be about things about getting out of bed, it can be going to the shops, it can be anything like that. But when that environment changes, we can't access it, that's when disability occurs. It's not about the person as such. I think it's fair to say that most of us make the assumption that we view and use technology, whether it's an assistive device, a digital device, a medical system or off the shelf, as a compensatory strategy to compensate for the effects of a brain injury or what a brain injury might result in, and particularly to do with some kind of form of loss of function, whether that's to do with vision, motor function, we've lost our function of our hand, maybe, as Gemma said, about her vision, maybe some hearing loss as well. So quite often we result and go towards technology to help resolve that issue. We're at a time where we've got so much technology to choose from. It's such a gift to have that opportunity. 10 years ago, the level of technology we had access to was nothing to what we have now. The fact that we can use voice-activated devices to control our environment, to help us remind us what to do for that day if we can't always quite recall that. If we don't know how to set up the temperature of our room because we need to have a certain temperature for our condition, technology can help with that. If we can't access a computer, there's software and buttons and all sorts of things that can help us access that. And it's great because that really offers potential to enable participation. However, where it does fall down is when we start to think and overgeneralise when technology can resolve an issue. So, for example, we get very caught up in about technology can replace, a button can replace somebody's hand function, a falls detector can alert somebody when has a fall. So although it's possible to classify functional impairment based on diagnostic criteria, it doesn't mean that the associated experience of disability be classified in the same way. So if we've got two people living with brain injury, they will experience disability in very different ways, and it'll be dependent on what their occupational needs and the contexts are within which they live. So if we've got two people that fall because of their injury, a community alarm might be the best option for one person. They feel safe, it's going to make a difference to their life, and somebody else might go, I don't want that. I don't want to be associated with a pendant like that. That reminds me of, they'll have some perceived idea of that, whatever that looks like for them. And also it might be not in the context. Their falls might be outside in the community. And actually it's more important they have technology that they can get help when they're out and about, not when they're indoors. So it's really about thinking how we prescribe technology. And moving away from that idea of how we prescribe health monitoring technology like heart rate, for example, is very different. That's a particular biomedical outcome that you want. But when it comes to other bits of technology, it's really about the person and what's important to them and what drives them and what's going to make a difference to their day-to-day lives. Okay, so part of this, I'm going to talk a little bit about the challenges that I personally experienced in trying to deliver person-centred interventions. Sometimes it worked, sometimes it didn't. And a lot of that's got to do with external factors out with the scope of my practice at times. And what I'm about to say is I'm going to mention sort of services, types of technology. Not for one moment am I saying that these are wrong, these are not, they shouldn't be there. It's just how they are provided in our world that makes it really difficult sometimes to access. So, coming back to that whole community alarm situation, it's quite often we are forced as practitioners to get people out of hospital beds, prevent hospital admission, close cases, move on to the next one. And so a lot of our interventions are pushed towards managing risk. So therefore we end up tailoring people to a particular type of technology like a community alarm in the hope that that will help and manage that situation. It can do, but it doesn't cover the full picture for that individual. To replace loss of function. So again, after brain injuries, Gemma had said again, she lost some of her vision. Other people are going to lose hand function, hearing loss. So there is particular technology that will focus particularly on that element of function loss. However, it's about looking at how that incorporates in that person's world. And as we discover and go through the challenges, what tends to happen is, particularly as an occupational therapist, you go, oh, they've lost their hearing, we'll refer to audiology, we'll go to the vision, we'll go to environmental controls, we'll go to somebody else. And before you know it, somebody's got a whole catalogue of technology that they have to learn how to use, work out where they're going to use it. And actually it starts to become overwhelming because sometimes they can't be integrated, so then it just all becomes a bit overwhelming and the equipment gets pushed aside. I mean, certainly when I walk into my dad's house, there's cat alarms hidden all over the place. I'm not using it, Julie, I'm not needing it. I found a hearing aid that belonged to me that I forgot I had. So again, somebody thought I definitely needed something like a hearing aid, but it's clearly not been important in my life to use it. Information governance, I guess that's the biggest bug that I experienced as a practitioner, particularly when I worked in a hospital setting. I wasn't able to access technology that could have helped with people's rehabilitation, things like applications which could have helped with the rehabilitation process, particularly around cognition, vision. And that resulted in either me using my own devices or asking the patient to use their devices. And sometimes it felt really inappropriate, but apps were purchased by patients that we hoped would be helpful for their recovery, and actually it wasn't. So there was a real mismatch there. The patient was out of pocket, they were disheartened by the use of technology, so there we go, we've got another bit there that just doesn't help meet the person's needs. Professional specific service provision, and I'm going to bring this in with criteria-led services. So I guess one of the challenges we all have when we work in the public sector in particular is that we get pulled on a wide spectrum of work, which doesn't allow us to always work to our core skills as a profession. So that leads to sometimes missed opportunities for people to get an occupational therapist, a physiotherapist, a psychologist that can really work on those areas that are going to help with participation. And other aspects is criteria-led services. So quite often when we refer to services, we know that certain services will only work with certain people because they've got a particular professionally identified disability or condition, and that then closes access to other people. Some devices are only there for medical purposes and can't be integrated, so again we end up having this accumulation of technology which makes it really difficult for that person to integrate and work with. It's not always like that, but it can be like that. So this was a little kind of framework that I put together with my colleagues at Queen Margaret as we were talking about our reflections on technology and how do we embrace that as therapists? How do we try to overcome some of those challenges? And there's nothing here that nobody will be aware of. There's no rocket science, unfortunately. And I guess the core thing is bringing the person with us, and quite often, as much as we try, we can miss that, and we think what's the right thing for that person, but not always. And we really need to understand what is it that's important for that person to be able to participate in that world. So again, going back to that falls example, it's fine if the falls are at home and that's important, but if somebody's going out and chooses to continue to want to run, but they're still falling, but they want to keep doing that activity, then we need to look at ways to support that. Evaluating that person's needs, so understanding not just how that person is, but also about how engaging with the technology is challenging, or engaging in that disability, that activity is challenging. So for example, I guess I'm going to draw on my occupational therapist knowledge here, but understanding what the demands of the task are here. How does somebody access a computer? What skills are required there? We know there's motor skills, there's visual skills, there's cognitive thinking skills there. So it's really understanding what those issues are and what the barriers are to participating. Oh, sorry. A big thing for me is supported person-led decision-making. So one of the things is about people being able to make a choice about their technology. It's not about, I've come from this service, these are the options here. It's about, these are the wide range of options here. Now, yeah, that could be overwhelming, but it's our jobs as facilitators to enable to explore and break that down for people living with any kind of injury where technology could make a difference. The person's got to be at the heart of that, because they're the ones that have got to make the decision, where possible, about the technology that's going to make a difference to them. They might choose something that we might think is completely inappropriate. We might feel it's risky, but actually it's not our choice, our decision, or within our gift to challenge that, unless there's real concerns about other areas which are where the scope of practice of this presentation. And supporting those options, so people can trial them at home, in the context where it's going to work, at home, at work, in the community, whatever that looks like. And being able to help support people to use that technology, follow it up. A bit like, it's not any different to a rehabilitative programme. You wouldn't give somebody a walking aid and just expect them to go tootling along the road with it. You would take them through a process. You would bring in the family. You would bring everybody else around with you. And that's not any different for looking at any digital device. I just want to quickly finish about George. It was a case that I worked with in practice. And I think George is a really good example. Yes, he had a brain injury. He also had a bit of a stroke. Gosh, anything you could think of happened to George. But one of the things about George is he experienced services where he was given technology, given services like packages of care, given a house, but actually it wasn't meeting his needs. And things started to fall awry for George in terms of he was getting his house broken into, he was in an increasing amount of debt, windows were getting smashed in. It's just, you can imagine a typical complex case that happens in the community. A referral came to me. I was working as a technology OT at the time, and I was asked, oh, George is having difficulty reading his bills. Could you provide some kind of technology around that? And he's having difficulty. I think it was just that, and also all these people that are coming to the house, could we have a camera put in? I was thinking, okay, wonder what George thinks of that. So for George, he was really clear there was going to be no camera in that house. That was his privacy. He was going to decide who was coming in or not, even though there was question about if those relationships were safe or not. But also there was a bigger impact. Who was going to be monitoring that camera? Because I certainly wasn't going to be doing that at night time in my bed, watching who's coming in and out. And what would you do with that information? So these are all things that needed to be considered. He'd been given a community alarm because it was hoped that he would call for help when he was in a panic, if something had gone wrong, if he didn't feel safe. But George didn't have initiation after his brain injury and stroke. He found if something happened, he wasn't able to take the initiation and pick up the castle alarm and then ask for help. He had a mobile phone, but he couldn't see the mobile phone because of his vision, but also because of his dexterity. He did have a landline phone, but it was a way out of reach, and actually it was cut off because of the increasing debt. Trying to understand what was important to George was really key here, because he didn't want the community alarm. He says, I've got 3 and I don't want them. I'd never used them. They were scattered all over the house. We explored what would happen if he did have a reading pen. Actually, George said, I can't read. It's not my vision. I just don't understand what's written there. So the technology could have easily been prescribed to say, there's a reading pen, George, off you go. But actually, what difference would it have been made? What would have happened? It would have stayed in a corner, and money would have been paid for something that didn't make sense to George. It was clear that technology wasn't going to resolve the issue, and I wanted to really make this clear because quite often in my practice it was like, can technology resolve a crisis? Can technology stop an adult protection case? Well, a little bit, but not on its own. It needs what I would call a bricolage approach. It needs a multidisciplinary team. I think it needed me as an occupational therapist, but it also needed my social worker with a mental health background, MHO qualification. It needed housing, it needed police. And what we ended up doing was looking at getting more support in to help with the paperwork and making sure that he was keeping safe and managing his money through a financial guardianship, rehousing to keep him safe, a better phone he could use, and actually a memo minder. And the reason I picked that, and I haven't shared that with you just now, is that he could respond to audio prompts. So he was really embarrassed when he missed appointments. He recalled the time that he panicked, jumped on his wheelchair and jumped to an appointment at the Royal Infirmary, only to discover it was the wrong day, wrong time. And he was just really disappointed because he was really proud that he got himself there, but just at the wrong time and place. However, auditory prompts, he said, I can respond to that. I can ask, what's on my calendar today type thing. And he was able to make sense of that. And he said, I like that because then I have control and I don't have to rely on somebody else or having to explain to somebody I don't want it written down. I guess the key message here is how important it is to have technology. It requires a collaborative skill mix. Seeing things in isolation sometimes works, but when we're working with complexities such as brain injury or any neurological condition, it needs a team together that can bring in lots of skills and expertise. And I guess that's the key thing there that I want to share. I hope that was helpful. And that's all I've got to say, and I just want to say thank you for letting me speak today, and thank you for Digby Brown for asking me along. And if there's any questions, I'm happy to answer them.
Any questions for Julie? Are we looking? Oh, God, I've got a couple. Back up, Julie. Back up.
Trustee Lieutenant, yeah.
First one. Who was it?
Hi, just very simple. Have you investigated in using an Alexa into helping people with technology?
Yeah, absolutely. It has made a big difference to some people's lives that we've been able to make that appropriate match. So things like, what's really nice about things like Alexa is that they can be used actively. So the person can ask quite clearly, as you know, tell me what the time is, set my temperature to X, Y, Z. But there's also, it can be used passively, so it can be set up to act remotely for people as well. So it can really work alongside a spectrum of conditions and needs and abilities. It's just knowing what it is and can it do what the person needs. Does that make sense? Yeah. Thanks.
Hello, thanks for your talk. That was really good. I was wondering, I'm guessing you work with people of all ages. So I was wondering if you use like different technology for different people, young people and older people. How do you what's the best way to keep up to date with modern technology? Or how do you kind of choose what would work best for people? Is there resources you have? Or?
I think that's a really good question, and it's a never-ending research. I remember when I worked at the Health and Social Care Partnership at Edinburgh, I created a catalogue. No sooner had the catalogue been developed, there was a whole load more technology that came about. It's having people like that are in the room today that worked alongside me where we're constantly on research and constantly looking what's new. But I guess for me the most important thing is looking at new technology, just everyday digital technology that comes out. So that can be quite quick to find and look and explore and just what are the possibilities there. But there's no logistic, no kind of clear methodology how I do that, to be fair. But it's about that communication, coming to events like this and seeing what's new, what's changed, what software updates there are. But it's almost a full-time job, I have to say. Yeah. Sorry, no answers there.
That's great. Thank you so much, Julie, and thank you. A round of applause for Julie, please. Thank